evening. We're grateful all of you are here and concerned about the folks of Wayne County and some of the services that each one of us are involved in and agencies and personally rely on, and I'm glad you're here. And our event today is sponsored by Ecumenical Community for a Compassionate Ohio. And we actually began to form back in 2004 when the Rubbermaid plant closed, and we began to see more needs arising in the community. And so we believe and we're formed to have relationships and conversations with elected officials so that we might make them aware of what we see in our community, and so that we might communicate to people in our churches the kinds of issues that are emerging.
My name is Ken Ward. I'm with Your Human Resource Center. We're one of the outpatient behavioral health centers here in Wayne County, serving Wayne and Holmes County. We could spend a lot of time tonight. We could talk about the economics of the Medicaid expansion program, what it would do for Wayne County, the numbers it would add. That's really not what I want to talk about. What I want to do is borrow a line that I heard Governor Kasich said when he was talking about his budget proposal for the expansion, and he said, he was asked very pointedly, why Medicaid expansion? Talked about budget, talked about economics, but most importantly said, it's the right thing to do. It's the right thing to do. You know, variously, we've heard quotes throughout history of talking about the fact that a society will be measured by what they do for the least among them, the neediest, the poorest, the most put upon. And that's been attributed to, we can track that back to Winston Churchill, Truman, Mahatma Gandhi. It's been attributed to a number of people. Cardinal Mahoney, most recently, espoused that very sentiment. And if that's going to be what we're going to be judged upon, then we better step up. I want to tell you a real quick story in the time that I've got left. And this story we see over and over and over in our organization and organizations throughout this state, and it's the person that we can't get the right treatment to because we don't have the funds. And so what we see very often is a de facto system of treatment where that person winds up incarcerated or in a state hospital. We had that somebody very near and dear to me who, through really no fault of his own, wound up an opiate addict because he was prescribed pain medication. Couldn't get the treatment he needed, wound up through a series of events incarcerated, finally got the treatment he needed in prison. Then we have a whole new host of problems when they come back out of dealing with the reentry issue. Medicaid expansion is important. Healthcare for all is critical, and I think we all know that. But again, to go back and borrow from Governor Kasich, it's the right thing to do. It's what we have to be about. You know, all those quotes that we just variously heard that have been attributed to all those people, they really track back, though, to Scripture. Really don't need to look much further than Holy Scripture. And if you want to see the very specific, look at Matthew chapter 25, verses 41 through 46. And it's a rather scathing indictment of those who fail to do what is right. And it's concluded with the words, whatever you did for the least of these, you did for me. Thanks.
Thank you. My name is Jamie Parsons. I'm the Executive Director of the Viola Startzman Free Clinic. And for about the last 18 years, our clinic has been providing medical and dental care for the residents of Wayne County who are low income and don't have the option of employer-sponsored health care or Medicaid or Medicare. In the early days of our clinic, our founder, Dr. Viola Startzman, was quoted with this saying in a newspaper article: "Healthcare is not a privilege, it's a right." And right now, Ohio is at a crossroads where we can sit and see the realization of her dream on the horizon through the Medicaid expansion that is proposed right now. Her dream, if that were to happen, would provide Medicaid coverage to over 6,000 Wayne County residents. That insurance would provide them with critical health care that they need to be productive members of our society. Without this expansion, as Robert just mentioned, many of these people fall through the cracks. They will not receive the subsidy to purchase insurance in the exchanges, but they will also not have that coverage under Medicaid. And unfortunately, that creates a financial hardship for the people in our community who are at the most financially fragile state in our community. I understand the opposition to parts of the Affordable Care Act, and I even applaud the people who are looking at the sustainability of the program and the long-term impact from a financial standpoint. But I asked tonight, how can we afford to not expand this program? Just today, the Ohio Health Policy Institute released an interesting study that I would encourage you to take a look at that showed a couple statistics that I want to share with you. If Ohio were not to expand Medicaid, more than 370,000 Ohioans would remain uninsured. That does not count those who would qualify for a subsidy in the exchanges. In addition, Ohio would lose an estimated $1.8 to $1.9 billion in net savings and the revenue that would be generated by the Medicaid expansion. Up to 28,000 new jobs would be forfeited that would have been created under the expanded coverage in healthcare and infrastructure jobs that would have been created. And overall, almost $20 billion in total economic activity would be lost in Ohio. And those are great, compelling statistics, but I want to close tonight talking about something a little bit more important. And I'm going to name this patient Jim. Jim is a patient who came to the free clinic a couple of years ago after his son found him unconscious on the floor of his home, not once, but twice. Took him to the emergency room, and he went home both times thinking there's nothing I can do about my condition, and so he had resigned himself to die. He didn't know that there was help out there for him because he didn't qualify for Medicaid, he didn't qualify for any insurance subsidies, and he just gave up until someone directed him to the free clinic. And over the course of several years, our very cost-effective model of healthcare helped him overcome the raging diabetes that had taken over his body. And it helped him learn to live again, learn to be a productive part of society. And Jim lives at 90% of the federal poverty level and is a childless adult at this point and does not qualify for anything except the expanded Medicaid. And Jim is sitting at home tonight hoping, beyond hope, that at some point he will qualify for Medicaid. And so tonight I urge you to think about the patients like Jim, more so than the statistics. Think about the neighbors that would be affected by this. Thank you.
George Rosiska, I'm a resident here in Wooster, Ohio. I spent 30 years on a fire department out in this town where it seemed like every night we were getting a call at 1 in the morning, my child has a fever, and we have to send a squad out there, take him to the emergency room, and as you all know, that's about 5 times more expensive than taking your child to a doctor the next day. Now, why are these people doing that? Because they don't have a family doctor. So that happens every minute, every hour, every day, 365 days a year, somewhere in this state. And who picks up the tab for that? It's the hospital, the county. It's just a vicious circle. And the argument is about Obamacare was 1/6 of the GDP of this country. Well, that may be true, but it should only be about 1/10 or 1/12. Our health care is just too expensive, and we can fix it, but it's going to take some doing. So.
Hi, my name's Kathy Rosiska. I think there's a relationship here. I'm really delighted to speak on behalf of Mocha House here in the Wayne Holmes counties. We are I think I'm right to say, a small but mighty program that offers recovery services to adults with severe and persistent mental health concerns. We've been in the community in the Manse on College Avenue, which is offered to us by the First Presbyterian Church. We're located in a lovely Victorian home, and we offer recovery programs for adults who come free of service and by their own choice. The key thing about these recovery services is that they're consumer run. Our participants design the recovery programs that we operate out of this lovely house, and they are spokespeople for their own needs. So I've brought 2 of these folks to speak on their behalf regarding Medicaid expansion. The 2 things I want to emphasize is that the physical health is so critical to mental health, and increasing access for folks to health care will greatly support improved mental health, as Robert Smedley reported. And the second thing I want to emphasize is that Medicaid expansion will allow our program to continue. And here are two people that will speak on their behalf.
Hi, my name is James Green. I'm a recovery and I attend Mocha House daily. For me, without Mocha House, I don't know what life would be like. It has been a very wonderful spiritual place for me to go. I found that it's just the best blessing for me to go there every day. And I know treatment works. People can recover. I've seen this happen every day that I go there. I'd like for Mr. Almquist to understand that we need to expand Medicaid now. I've been to Congress and testified before him to let him know how important this is to me and to my fellow friends and colleagues at Mocha House. And I just want everybody else here to understand how important that is, because there are so many people that have not been able to get the services they need for mental health, addiction services, etc. And with the Medicaid expansion, those services can be met because they'll be able to qualify by expanded Medicaid. And I want to see this happen so that hopefully Ohioans can survive better. They can become productive citizens. They can maybe get back to work and have a job. I don't know in Wayne County if that's going to happen or not, because I know jobs are very few to come by in Wayne County, but it's a possibility here. I also know that there are people that if they can't come back to work, they can at least volunteer, and that's what I'm going to do. I'm not able to go back to work full time anymore, but I can volunteer my time. I volunteer it every day, and I gladly willingly do this. It's not something that's forced upon me to do. And I appreciate everybody's concern here. I hope that this Medicaid expansion does pass. Thank you for your opportunity to listen to me today.
Hi, my name is Lisa Elgato, and I'm a statistic. I also go to the Mocha House. I've been going there about 7 months, since October. I'm a recovery. Without the Mocha House and the support group that is there, and the advisors and the whole faculty, I would be in a mental institute probably for the rest of my life, which would mean you would be paying for me one way or another. I would not have the opportunity to interact with people, to volunteer at the Mocha House like I do now. I'm becoming socialized. I'm becoming a responsible human being again. And it's all due to the Mocha House and what it stands for and what it can be. Without the Medicaid expansion, places like the Mocha House will no longer exist. People like myself and like James will no longer have places to go. And will we fall back into the cracks of society? I fear we would. So please keep it in mind about Medicaid expansion. We really need to keep it going. Thank you.
I'm Bob Yumboro, and I teach high school at Northwestern High School. I've been there for a while. Dave Gillespie asked me to come and talk about the education stuff. And early in my career, I didn't pay too much attention to how schools were funded. However, as the schools become more strapped for cash, and as I assumed a role as a union representative in negotiating contracts, I've been more interested. What I've come to realize is that school funding is incredibly hard to fathom in this state. It's not based on any simple, easily understandable formula, concept, or idea. It's not static, as it seemingly changes and shifts from budget to budget and from place to place. I've begun to suspect that our state leaders have encouraged this confusion. Even after many years of informal study, I know that I have only a rudimentary understanding of all the details of the beast that is school funding in Ohio. Consequently, recently I talked to my local superintendent to confirm and flesh out my perceptions. My message, contrary to what our politicians tell us, is that overall state funding for public schools has fallen continuously in budget after budget in recent years. This reality has been accomplished in two ways. First, by siphoning off more and more local district money for profit charter schools, most of which perform more poorly than in public schools. Budget after budget has allocated larger and larger sums to charter schools. In addition, the number of services like busing and local schools must provide to these charters has grown, as has the corresponding expense. Public schools are left with fewer students and fewer dollars with which to pay their normal fixed costs, like building, upkeep, salaries, and busing. The second method by which the state has reduced dollars to public schools is by reducing the amount of money provided for supplemental services and/or by folding that money into basic foundation funding. Each district gets based on its per pupil numbers. For example, transportation dollars have been cut by 95% over the last 10 years, And whereas transportation used to be a separate budget item, it is now included in the foundation formula. Gifted education used to be a separate fund, it is now included in the foundation formula. Another egregious example, the current budget would cut multi-county educational service centers to provide services in the areas of special education supervision, curriculum development, preschool, fine arts, and gifted education by 30 to 40%. Local districts will have to absorb these cuts, pay for them out of their foundation money, or do without. The result of these strategies is a shell game, and that has and will reduce the total dollars provided to our public schools. Even though the amount of foundation dollars given on a per-pupil basis, the state contribution to local schools might be the same as 5 years ago, which represents a substantial reduction in inflation-adjusted dollars. I have another number of other concerns. The legislature has phased out personal tangible tax. It has limited a bunch of other sorts of funds that they've given. But in general, it appears to me that instead of fulfilling Ohio's constitutional requirement to educate Ohio children adequately, the real intention of recent budgets appears to be primarily to reduce the overall cost of Ohio education. By bankrupting small school districts, to force them to consolidate with larger districts, by driving down the compensation of school district personnel, and by shuttling public money to poor-performing for-profit charter schools under the guise of choice. I like Mr. Kammer's idea at the beginning that what we do with our budget really is a moral choice. And I think the schools really represent that. Thanks.
I want to say a few words just to contextualize things. Probably none of this will be particularly new to you, but perhaps give you a backdrop as you carry on your discussion. At one point, as many of you know, Jesus was asked to summarize the entirety of the moral law and the moral code. And Jesus said the entirety of the moral code can be summed up in this: love your neighbor as yourself. Well, there was, of course, a lawyer present who immediately understood the issue that was involved here and responded with the question, well, who is my neighbor? And perhaps you know the rest of the story. Jesus responded with a story of his own. There was a man walking down the road to Jericho when he was set upon by thieves. He was beaten and left to die along the side of the road, robbed of everything that he had. While he was lying there dying, a very devout man came walking down the road, a man who attended religious services religiously, a man who prayed daily, a man who read scriptures, a man who had an important religious voice in his community. And he saw the man lying there and probably thought to himself, well, there may not be much I can do to help, but after all, I'm concerned about spiritual and religious things, not about bums lying along the side of the road. And he probably thought to himself, well, this man probably did something to put himself in that situation anyway. I have no moral obligation. And so he walked on by. And then a second person came along, a well-to-do member of the community, well-respected, probably had significant political power, came walking by and saw the same man lying there, beaten and dying alongside of the road. We can imagine him pausing for a moment and looking down and seeing very little human resemblance. For here he was, dressed nicely with a position and power, somebody who had worked hard to get where he was, looking at somebody lying alongside of the road, and decided there was no need to stop, and kept on walking. And then, of course, the third person came along, a not particularly important, somewhat despised member of the community, somebody who was known to not have much moral worth or moral value. And this person stopped, and he picked the man up, and he carried him to an inn, and he said, bring him back to health, and I will pay whatever it costs. Whatever it costs, even if it's down to my last penny, I will pay it, so this man can be cared for. And Jesus ended the story. But the interesting thing then is what Jesus does. He turns and says, not, your neighbor was that beaten man, for in Jesus' mind that becomes evident, right? Our neighbor, the person who needs our love, is that person who is in need, who draws at our deep levels of compassion, who lets us see humanity when it's been violated, and we see and respond viscerally to their need. But rather, Jesus turns and says, who acted like a neighbor? And that, I think, is the intriguing question. And so what I want to suggest is we'll begin to look at budgets. It's easy to look at budgets as simply numbers, as debates over who gets what, as to who has the most power to determine where money goes, but budgets are moral documents. And I argue with this at the college as well. They are moral documents. When somebody says to you, we cannot afford this, what they're saying is, we do not value this enough to put our resources there. Budgets are about moral priorities. Budgets are about what we value. Budgets are about what we think is important. And so what I want to suggest to you as we begin to think about budgetary issues is to raise two questions. Who is my neighbor? And then we discover that most of the religious traditions are in agreement. So we have the verses from Deuteronomy. We listen to the voice of the Hebrew prophets. They are very, very clear. The neighbor is the person in need. Running consistently throughout the Hebrew prophets' diatribe and message towards Israel is simply the following. You must care for the poor. You must care for the widows. You must care for the orphans. And if you fail to do that, this society will collapse out of moral decay. Greed leads to collapse. Compassion creates communities that survive. Islam has 5 pillars, 5 things that a Muslim must do to be a good Muslim. One of those is give alms, and those alms go primarily to the poor. The Quran is very clear. Muhammad was very clear. If you do all of these pillars but don't care for the poor, forget about paradise and forget about the community. The community will disintegrate if the community does not take care of its own. Buddhism, there's a notion of the interdependence of each and every one of us, with the understanding that what we do to someone else or what we fail to do reverberates back on us. When I fail to act in a compassionate way, it harms somebody who doesn't receive my compassion, but it harms me even more. It begins to disintegrate my very own humanity. It begins to make me callous, and it dries up that which is best in me as a human being. So the point I want to make is that all of the religious communities, all the religious voices are agreed upon one thing. Our neighbor and that person to whom we have the most significant moral responsibility are those who have the least. Those who are powerless, those who can do little for themselves, are the persons who have our primary moral obligation. But secondly, all the religious traditions raise the issue then of, well, will we be neighbors? And they do want to say that our moral worth, our moral value as individuals and as communities is measured by how we respond. So as we begin to look at budget issues, I think the critical issues begin to arise. What kind of moral community we want to be, whether in Wooster, state level, national level, international level. What is important to us? Where does our moral fiber and being resonate? We make sure that there is money there for those who are underhoused. Is there a priority there for money for those who are underfed? Is there a priority there for lifting the educational quality for those who are currently in deprived educational situations? Do we make money available for health care for all citizens? Or do we say no and deprive 250,000 Ohioans of health care? Where do we decide when we begin to look at the budget what has our priority? I want to suggest that one of the unfortunate things from the federal level on down, I don't think it's a Democrat issue, Republican issue. I've not seen much discussion from our current president, who is a Democrat, about poverty policy and poverty programs. I've not seen much discussion from Republicans on the other side around those who have been most disadvantaged in our society. So I think the question becomes, as we look at budget issues, what do we want our communities to reflect? Do we want to be a community that may trumpet religious and moral phrases, put on a sanctimonious moral robe and pass by those who have been beaten up by life and left along the roadside? Do we want to be a society in which the wealthy and the well-dressed and the educated continue to receive privilege and walk down the road and leave those persons lying along the roadside? Or do we envision ourselves as something different than that and better than that as individuals and a community? Now, the second thing I want to do, which is a bit more dangerous as somebody who teaches ethics, is to indicate that having the intention to do the good is good, but not sufficient. One has to know something about the context to which one is responding. So programs need to be well researched and well applied if they're really going to be beneficial. And we have a number of persons here today who are representing very, very important programs that are reaching out to and meeting those persons who are in real and significant need. We have good ideas about how to shape those programs and good ideas about how money can be used. I simply want to point to two general pieces. And one is that an awful lot of our budgetary policies, local all the way up to federal, and an awful lot of our tax policy has been based upon a profoundly flawed economic ideology, which is sometimes called trickle-down economics. Jim Hightower, who is a former congressman, policy analyst, and has a little sheet called Lowdown, which is a nice piece of information, writes as somebody from Texas who has been a farmer, he understands trickle-down because he's often run manure spreaders. The reality of trickle-down is it presumes that by transferring wealth from the least well-off and the middle class to the wealthy, that will create jobs. The wealthy will take that money and invest it in programs, jobs, businesses, which will then invigorate the economy. It's a nice idea, but it doesn't work. We have no evidence that it has ever worked for some very simple reason, and that is the economy is stimulated by people's willingness to purchase goods. Unless there is demand, it doesn't matter how much productive capacity you generate. You have to have people buying goods. But oddly enough, people without money can't buy things. And so it turns out that the best economic policies, and I saw somebody had Paul Krugman's book on anti-depression now, okay? The best way to begin to generate jobs is transferring wealth from the top back to the middle and the bottom. Every place that that has been done, the economy has been stimulated because you now have people who have money to buy things, and you now create new productive capacity to meet that demand. Over this current economic recovery, the top 7% in the United States have seen their wealth grow dramatically by 20 to 25%. The bottom 93% have discovered that their wealth and income is stagnant, and as we move down the scale, they're actually in worse shape than they were before the recovery began. During this recovery time, corporations are making all-time record profits and have refused to hire people back, even though they have the excess profits now to do that. They are simply not interested. So issue number one is much of our budgeting has been based upon simply a flawed economic theory. But second are the profound and significant economic consequences. We have a number of studies now out, one by Stiglitz, a Nobel Prize-winning economist, another by the man by the name of Wilkinson, looking at the impact of inequality on a society. And they're finding some very interesting and repeatable correlations. The greater the inequality you have in a society, the number of social problems that begin to become exasperated. So the more inequality, the lower your educational achievement is. The more inequality, the lower your life expectancy is. The greater the inequality, the higher your crime rate. The greater the inequality, ironically, the less social mobility. Turns out that the United States has one of the highest levels of inequalities in the world, leading both commentators to suggest that if you want to live the American dream, that is, pulling yourself up by your bootstraps and moving up your social class, you had better pack up and move to a country in Europe or Asia, because it's not happening in the United States. We have the lowest levels of social mobility now pretty much in the world. So the point here once again is that many of our budgetary policies and tax policies are actually exacerbating that inequality and generating the negative social effects that one can predict. The greater the inequality, not just nationally, but inside a state, the more problems you have. So the states in the United States that have the least inequality are doing best on all social measurements. Those states with the greatest inequality are the ones who are doing worst in terms of positive social measurements. But I want to come back to where I started. All of that is important, but budget is really a moral reflection. Budget is a reflection of what we value and who we value. And so I want to come back to the Good Samaritan issue. So what will we reflect with our budgets? And it's true of our own individual budgets. Where do we spend our money and how do we use it? It's true of the budget at the college. It's true of the city of Wooster budget, the state budget, the federal budget. Are we going to be those individuals who are concerned about creating a community that is based upon understanding the moral worth of every human being? Will it be a moral community which will, over time, will create a community of compassion and care and so be a long-lasting community? Or will it be a community that allows more and more persons to lie along the roadside and die, while we continue to build our own affluence in small segments of the community? So simply as we move through the process tonight, simply encourage you to think about budget as moral process and not simply economic process. Thank you.